If you have what I call, a limiting belief that I don't think I can do that behavior, you're not going to do it. Why do people fail at their goals? What's the number one reason we failed? It's not rocket science. The number one reason we fail, it's not outside circumstances. It's not what's happening in the news. It's not, it's not all these outside factors. The number one reason we don't achieve our goals is that we quit.
Welcome to Unstoppable Brain. I'm Dr. Kyra, and we're here to translate neuroscience into behavior change and the life you want. This week, we're going to welcome Nir Eyal, who I met way back at Stanford when I was at the Stanford Behavior Design Lab, and he came by and showed his Hooked model, which became a best-selling book later on. Nir has done very well to translate behavioral science and brain science into meaningful behavior change, meaningful life change. But here's the thing. His most recent book, I find to be his best book. I find it to be his best work, most thoughtful, called Beyond Belief. And we're going to break it down in this conversation next. It's so great to see you, Nir. I've missed you in my life, and
It has been a bit.
I've seen you on all the big stages and all the places in the world. And, thanks for having, compassion on my little, podcast startup energy here. And yeah, I was really looking forward to this. And let me just start officially, like this, as I was reading your book, honestly, I was like, is this his opus? I
Oh,
was
wow.
I was really honestly impressed. And this
Thank
is
you.
not a negative from the first time we met, but I remember you kind of strided into the Stanford lab and you were kind of this young, wonderkind, smarty pants, and you had all the answers. And then your Hooked book just went like explosive, and then you did Indistractable, which my daughter actually reminded me this morning that I sent her that one, in a moment of need. So that was a therapeutic book for my kid as well. And this one, Beyond Belief, I was like, oh my gosh, like, where did this writing skill come from? Like I just full respect
Thank you.
to the
Wow.
writing skills that you've cultivated, dear friend. I'm really impressed.
Thank
And
you.
yeah, and so I guess my first question for you is, so, why a third book? What was the intention? And then why belief? Like, how did you land there of all things?
Yeah. Well, first of all, thank you so much. That means so much coming from you, given your background and experience, and that means a lot. This book is definitely the thing I'm most proud of that I've ever worked on, and I think has changed my life more than anything else I've ever worked on. Because it's I think when you get to a certain age, it's hard to be surprised by stuff, right? We've kind of seen a lot already. You've seen the research, you've seen the lot, you've heard the stories that kind of make the rounds. Like, okay, I know some of that. But I had this nagging curiosity in everything I write. I don't write because I know, I write because I want to know. And this one took me 6 years to write. Um, because there was just so much fascinating research around beliefs. It started out actually a book about placebos. I thought that was very interesting.
Yeah.
However, placebos led me to kind of a dead end in that they're very interesting. There's actually is a good chunk about placebos in the book,
Yeah.
but they weren't as magical as I think people think they are, right? Like,
Absolutely. Yeah.
placebos don't cure cancer, they don't heal broken bones, but boy, do they have an impact in terms of the perception of the pain that comes with those sicknesses.
Yeah.
And so that thread that I pulled on led me to all kinds of interesting, discoveries, and so
Yeah,
it really,
we'll get into that. Yeah. We'll
yeah,
get
absolutely. I don't know if that was part of it. I mean, I'll back up even further to that. The real genesis was that, I wrote Hooked, I wrote Indistractable, and I did these office hours where anybody can call me. I do 1 hour every week. I still do them, 15 minutes. You can book time with me and ask me anything you want. And, every once in a while, out of these calls, maybe like 1 out of 20 or so, someone would call and say, "Hey, Near, I read Indistractable. I really liked it, but it didn't work."
Mm.
I said, "Oh, wow, tell me more. It didn't work. I spent 5 years writing it. There's 30 pages of citations to peer-reviewed studies. Like,
Right.
what didn't work for you? I put so much effort into it. Tell me, I wanna learn. How was step 1? Tell me how step 1 worked out for you." And they would say, "Oh, I didn't do step 1. I skipped step 1." Okay, no problem. I get it. Tell me about step 2. How did step 2 go? Yeah, Nir, I read step 2. I definitely read step 2. I just didn't do it. And here I am thinking, I put in all this work to solve this problem that everybody says is terrible, right? Our brains are melting because of technology and nobody can stay focused. Everybody's distracted. And I said, okay, here is the solution on a silver platter. Here is the answer. 5 years of research. It worked for me. It worked for thousands of people. Here you go. Here it is. And I kind of didn't understand why they didn't put it into practice. And so I really wanted to understand what was going on. And I- and and then I realized, wait a minute, I don't have to look that far for the answer. It happens to me all the time, right? How many books do I have that I haven't put into practice? How many consultants have I hired? How many coaches have I worked with? And
Yeah.
I haven't made those changes. And so I
Right.
wanted to really figure out, why is it that despite knowing what to do, the behavior,
Yeah.
and why we should do it, the benefit, why don't we put it into practice? Why do we lose motivation?
Yeah.
And what I realized was that there's a missing piece to all this, which is you can know what to do, the behavior, you can know why you want to do it, the benefit, but there's a missing piece of the triangle, what I call the motivation triangle. And that is that at the base of the motivation triangle is belief. And if you don't have a belief in the benefit accruing, so for example, if you don't trust your employer to give you that bonus, if you don't trust your business partner, if you don't trust your spouse, if you don't trust whatever, you're not going to do that intended. You're not going to, if you don't believe you're going to get the benefit, or, and much more common, is if you don't believe yourself.
Yeah.
If you
Yeah.
have what I call, a limiting belief that I don't think I can do that behavior, you're not going to do it. And so that really was what I wanted to figure out, is how do you establish the right beliefs that can sustain motivation, so that that when we do know what to do and we do decide we want to do it, that we actually get it done, that we can actually fulfill our dreams.
I find that we have arrived in kind of like the same valley or the same meadow, if you will, because following that question, I know what to do, I just don't do it myself. I led me to the brain. We'll talk about some of the brain science that you share in the book here. Led me to mindset, a specific kind of mindset that I kind of
Good.
back engineered out of people who could make that contact. So we'll get into that. But one of the things that I really was surprised by was that you'd been dieting as a child, or you had weight problems as a child. And I was like, I didn't think Nir had any problems. And just forgive me for
Oh, I'll show
projecting
you
that onto
pictures.
you. I projected that you didn't have any problems, or that, you really were totally great all the time from birth to now. And I grew up in Oklahoma, and I had, weight issues from probably like
Really?
12 on, because I had depression, I had emotional eating, and I was stuffing my feelings and things like that. I wasn't ever like really in the upper class, but I was like in the lower end of like overweight. But for a high school kid, that's very painful because there's so much comparison going on. And the thing I thought was so astute about how you opened the book was really talking about, it wasn't the thing that I was focusing on. It was, or the thing that worked for me, whether it was paleo or, intermittent fasting, or this or that. You kind of go through some of the iterations a little bit. But it was meta to that. It was the fact that I believed in this. And it just instantly took me back to um, this interview between, I think it was Tim Ferriss and Andrew Weil, who's like a integrative medicine guru, MD from a long time ago. And Andrew Weil, Dr. Weil said, the diet that works is a diet that you believe works. So I just
Mm,
instantly saw that parallel between how you had that awareness of yourself, that the kind of metacognitive awareness of what you were doing. How did you get there? Like, how did you understand, when there's so many, jumping from thing to thing to thing that people do, like, oh, this is the solution. Now I'm in love. I'm going to do this forever. And then, oh, that didn't work out. Now here's, how did you understand? How did you even get a
yeah.
sense of, like, because you're the fish in the water. How did you know that you were in the water?
Yeah. Yeah. Well, uh, it was quite a painful experience. I remember my mom took me to the doctor because I wasn't just overweight. I was actually clinically obese, and I remember very clearly the doctor had this chart. This now it's horrible, and I remember
Yeah,
seeing it,
right.
that it was like the green zone, right? It was like height and weight, and here's the green zone, here's the yellow zone, here's the red zone. This is you.
Oh,
You're where in this
jeez.
red zone of clinically
Oh my
obese.
God.
And yeah,
What a blow.
it was, looking back, um, I didn't at first, I would blame the food, right? I would blame, "Oh, it's because food is delicious, and I like it very much, and I'm hungry." But you and I both know, and all people who struggle with their weight, really, it's not the food. We love to blame the food companies and the food industry, and yes, they definitely play a role as well. But at the end of the day, it's I wasn't eating because I was hungry. I was eating my feelings. I was eating because I was lonely. I was eating because I was bored. I was eating because I felt so much shame about how much I had just eaten. That
Yeah.
was really the source of the problem. And so it wasn't until I dealt with that, that I could overcome it. And today, I still have to watch. I would say, it's a challenge to stay healthy. I think it is for everyone these days when there's such an abundance of delicious food out there. But I think what really changed for me, looking at, in retrospect, looking at what I was going through, whenever I stuck with the program, it almost didn't matter what the program was.
Right.
Uh,
Right.
I would see the benefits.
Mhm.
And so the amount of time that I spent on, "No, it's keto. No, it's vegetarian. No, it's intermittent fasting. No, it's this." And I had the religious zeal that would drive everybody crazy, right? I would go to parties and that'd be all I talk about is metabolic balance and this and that. I would go on these tirades, and it worked as long as I was a fervent believer in it. And then whenever there was some doubt that crept in, that, oh, maybe that's not such a great diet, or maybe the next fad comes along, then I would say, ah, well, that doesn't work, and I would start eating again. Not only would I start eating again, I'd start overeating again, and so
Oh,
my
wow.
my weight graph looked like a roller coaster. And so looking back, really the determining factor was what I would stick with. And so that goes back to what we were saying earlier about how important motivation is. If you think about it, why do people fail at their goals?
Mhm.
What's the number one reason we fail? It's not rocket science. The number one reason we fail, it's not outside circumstances. It's not what's happening in the news. It's not all these outside factors. The number one reason we don't achieve our goals is that we quit. It's as simple as that. We quit. Now, that doesn't mean that quitting is the wrong answer. Many times, quitting is absolutely what you should do. Lord knows I've quit all kinds of things. I've quit relationships. I've quit book project. I've quit businesses. I've quit all kinds of things. Quitting is not the problem. Quitting before it's time. Quitting before you've exhausted yourself, right? Before you know it's time to go, that's a shame because you haven't met your potential. And so that happened to me many times in my life that I quit a business too soon, and then a year later somebody else succeeds with the same exact idea, or that's sad. Or my weight loss journey, trying, and then quitting every time kept me back. Whereas if I had just persisted, that's what I do now. I realized it's not about any magic solution. Basically, for the vast majority of people, it is calories in, calories out. Not for everybody, for the vast majority of people, that's the formula. So you have to eat right and exercise more. And doing that consistently and not quitting is the answer. And so that's really what I wanted to figure out with Beyond Belief. Like if I could take all kinds of behaviors that I don't like doing, I'll be honest with you. I don't like exercising. I still don't like exercising. I do it, but I'm not, if they told me tomorrow, hey, you can lose weight without exercising ever again, you'll be just as healthy. I wouldn't do it anymore. I'm fine with that. so, so if I could figure out the how to crack the code on learning to persist through difficult behaviors that are painful, that aren't fun, so that I can get what I really want in life, that to me seemed like the ultimate cheat code. So that's what I wanted to figure out with beliefs.
That's awesome. And then what is your latest iteration then of the belief that is driving your health right now, either on the weight management side or on the exercise side or some other healthy habit?
Yeah. So I got rid of my limiting beliefs. That's the macro level um, value of what I've been doing over the past 6 years and what's in the book. It's how to identify our limiting beliefs that are hidden to us that we don't even realize are there, and we all have them about one area or another of our life, whether it's our beliefs about our health, whether our beliefs about relationships, about work, about everything that limits our potential. We have these hidden, ugly, limiting beliefs that we don't even realize are there. And how do we turn those into liberating beliefs? So a big one for me when it came to exercise is that I thought that um, that pain was bad. It seems so
Don't
basic,
we
right?
all? It's a
Yeah,
loud noise.
that's
Yeah.
it's hardwired, right? That if it
Yep.
hurts, stop doing it.
Totally. Yep.
And there's definitely a certain kind of hurt, and we know what that hurt feels like that we want to
Mhm.
avoid. But that
Mhm.
almost never happens when I take my little walk or I go to the gym or I go on a little jog or I do some push-ups. That is not the same hurt. The hurt is I don't wanna, right? I don't feel like it. But it's just a feeling. It's just up here. It's a belief that I had that if I don't want to, that I should avoid it. That discomfort means avoid. And that's what I did with all kinds of things. And I talk about in the book how that same avoidance comes back to bite us again and again. If you look at chronic pain, for example, chronic pain is a rumination illness around avoidance, avoidance, avoidance. And so the standard advice of, oh, you hurt your back. Well, don't move, ice it, avoid that behavior. Don't do anything that might exaggerate, and that might stress that behavior. Turns out I don't follow that advice anymore. So I have had back pain. I've had back pain for years. And every time I feel that little twinge, I used to say, "Okay, don't move, don't move, don't move, and I wanna feel it again. I don't wanna feel it again." Nope. Now, you know what I do? I do the exact same movement 10 times.
You confronted me on that because I actually had a back injury during a surfing trip in 2016. And I was in a yoga class with a beginner yoga instructor. Like she'd just gotten certified and she was trying to put the hurt on us, trying to prove herself. And she did this like crazy, we are super stretched out and then we're supposed to flip over onto our backs with like in a back bend or whatever. And my back went out and I've never experienced that before. And it was to your point around the fear and the pain just started swirling together. I quit surfing and I, really quit working out really hard to your point, at that point. And when I was reading your book and I was thinking about this, I what really jumped out at me was when I went to the orthopod and had an MRI of my back, there was all of this damage that was, on the list of the MRI report, like, all these changes, bulging discs, all these things. And even like a congenital fusion of my L5S1 on my right side. And I was like, oh my gosh, I shouldn't move, to your
Yeah.
point. And it really has been, and you talk about this in the book. I forget the name of the artist, but the song was "Throw Some Ass."
Sophie. Yeah, Sophie Tucker.
And I was like, "Oh, okay." Nir's talking about throwing ass. All right. So,
But you
but
remember
but
it,
but
right?
but
You share
unpack.
it.
I did. I mean, I was. It was so smart of you to include that because it was memorable. So maybe tell a little bit about that transcendence of those beliefs. Yeah.
This really blew my mind. I was and I can't take credit. By the way, I can't take credit for any of the research I'm gonna share. My job is to synthesize that research and share it with others, research that I think needs a lot more attention. And one of these amazing techniques is called, pain reprocessing therapy, which is very well backed, thousands of peer-reviewed studies that show how effective this is. And essentially, pain reprocessing therapy says that chronic pain, we're not talking about acute pain, right? We're not talking about, oh, you broke your arm or something. We're not talking about that kind of pain. We're talking about the kind of pain that lasts after 6 months. That's
Yeah.
kind of the definition of chronic pain with no known physical attribute. And we find this in all sorts of things, not just chronic pain, on your back or something, but fibromyalgia, which is kind of this default diagnosis when we can't figure out what's going on. And that's kind of the label we give people, but there's no like blood test for something like fibromyalgia or chronic headaches or insomnia, or there's all kinds of these illnesses that we can't find a physical cause for, but people suffer from. And so one of those, with when it comes to chronic pain, uh, the theory behind pain reprocessing therapy is that folks are caught in this fear loop, that when they feel that pain, they become very scared, right? And just as you
Mhm.
did, "Oh my goodness, that means
Mhm.
I can't surf anymore." It means, "When is this gonna end?" That's the most common result is, "This is terrible and it's never gonna end." And that fear programs the brain to be hypersensitive to anything that might trigger that pain in the future. And so what you're doing is, and this is what I talk about in the book in terms of the 3 powers of belief. The first power of belief is the power of attention, that
Mhm.
because we live life through a keyhole, that we take in about 11 million bits of information per second. So right now, 11 million bits of information your brain is taking in, but you're actually only processing about 50 bits of information, 50 versus 11 million. And so
Mhm.
what the brain has the amazing power to do, because it can't process all that information, I can prove it to you right now. If you listen to my voice at the same time as you listen to the hum of the room, and think about your breath at the same time, impossible. You can't do it.
Mhm.
Your
Mhm.
brain can't process all that information at the same time consciously. It's looking, it's kind of scanning, like kind of almost like one of those security systems where it goes camera one, camera two, camera three. That's
Mhm.
actually how your brain works. It's not taking in everything at the same time. What that means is that when something is a high threat, when something is very important, that information channel becomes flooded just with that one piece of information. And the way that happens is that when something is dangerous, when the brain thinks something is a threat, it hyperfixates on that threat.
Mhm.
And so
Mhm.
what you're doing is you're training your brain that any tiny signal that may cause that pain, that may be associated with it, almost in a Pavlovian way, the pain dial goes to 11. To me, that didn't make sense. How could that possibly be? Pain is here, my back hurts, right? How could my
Mhm.
brain be making my back hurt? But of
Mhm.
course, all pain is in the brain. Pain is not in your back, right? Pain is in your brain. All pain gets processed. Doesn't mean you're making it up. That's not what I'm saying. All pain is real, but all pain is in the brain. And so what pain reprocessing therapy tries to do is to reprogram the brain to realize that that sensation is just a sensation. It's not a threat. It's nothing to be scared of. And again, it's only for the kind of pain that lasts for more than 6 months. So we know it's
Mhm.
not any kind of long-term physical problem. What's interesting as well, by the way, you said how you went to get a back scan and they found all kinds of issues. That is super
Yeah.
common. That if you go
Yeah.
and get a back scan, almost 100% chance they're gonna tell you you've got a slipped disc, you've got a this, you've got a that. It's not as precise as the doctors make it sound, right? When a doctor says you have a slipped disc, it's a little blobby gray patch that they're talking about that if you looked on the X-ray, you probably wouldn't be able to see, and, they many times they can't see it either. They're looking for a diagnosis to give you. And so what's interesting, though, is that there isn't a correlation between who has a slip disc and who has pain.
Yeah.
Isn't that
It's so
amazing?
fascinating. That's
Isn't
so
that amazing? I mean, a
fascinating.
broken arm is a broken arm,
Yeah.
you're gonna feel pain. But what happens is even if you have some kind of, of sickness, even if you have something wrong with your body, the brain learns to tune out that signal if it's not important, if it's not a threat. So even many times when people do have something physically wrong with their bodies, they don't feel that pain. There's no direct connection because the body's not
Mhm.
threatened. And
Mhm.
so and
Mm.
other times, even when there isn't something wrong with the body, we develop this rumination illness and we create that pain in our brains. Again, it is
Exaggerating.
all pain is real. You're not making it up. But it doesn't necessarily mean that you have to suffer from all sorts of pain. So pain reprocessing therapy, and back to your what you said about Sophie Tucker. Sophie Tucker is a name of a band, a Grammy-winning, band, and the lead singer had terrible back pain, and then she started getting migraines, and it was threatening her
She's
entire
a young
career.
person, right?
Yeah,
She's
in her
was
20s, in her 20s.
yeah.
And
Mhm.
and so she was just laid out with this back pain, and she tried everything, acupuncture and drugs and all kind of everything she could imagine. And it just got worse and worse and worse. And then when she tried pain reprocessing therapy, which tries to break that link between the fear and the pain, she essentially cured herself, and the way she did it was through dance. That
Mm.
she learned that the movements that had caused her pain, if she just did those movements again and again and told herself, "Hey, this is not harmful, this is not scary," and in fact, part of pain reprocessing therapy is adding levity. So making it
Mhm.
fun, making it
Mhm.
something you can
Mhm.
laugh at, making something you can enjoy. And so
Mhm.
what she did after this entire process, she wrote a song, you can find it on YouTube, called "Throw Some Ass."
Mhm.
And the lyrics are "Throw some ass, free your mind." That
Mhm.
when you dance, when you move your body, you teach your brain that these movements are perfectly safe and in fact super fun, and now she doesn't suffer from that pain anymore.
So I have thrown some mess as a result of, coming back from my fear pain complex that you're describing. And it was just kind of like by virtue of I love to dance so much. I just didn't want to lose that. And so at some point I just did it. And I just like, well, if I throw my back out again, like, so what?
Mhm.
But it really was such a feat of that. What do you say to people because, that fear is real, and I know that
Real.
you're not saying that it's not real and that the pain isn't real, but you're trying to offer a way out, and yet I think that, so many people have so much pain, and it appears so real to them that, it's almost like impossible to think about like how they could really get out of that loop or even believe you about believing this, believing in themselves. What do you say to people who are so really afraid of letting go of that pain or feel even sometimes offended? And we'll get to like identifying as a diagnosis later, but
Yeah,
almost get offended of like, how dare you, question or tell me that I'm making it up or that kind
yeah,
of thing. Because I had that experience when somebody meaning well, told me about this, like, "Oh, there's this pain, back pain book, and it just talks about, how you just it's all in your mind." And I remember
sure.
feeling offended or not
Of
seen or
course.
whatever in that case. And so how do you kinda delicately get in there and free people from this trap they're in without all of that, big reaction and them feeling like they're not being, given empathy, if that makes sense.
Absolutely. I
Yeah.
think that is definitely the knee-jerk reaction, and I felt that offense at first as well when I heard about this, and, to be clear, I wanna say it again, all pain is real, but suffering is optional.
Mm, I
All
like
pain
that.
is real. That nobody should tell anybody that they're not feeling pain. You feel pain, you feel pain. It is real, but that doesn't mean you have to suffer from it, and it doesn't mean it can't change. I think the difficulty is that there's so many commercial interests that want to tell you a different story,
Ah,
right? We see this every
let's
day,
talk about
right?
that.
Just
Yes. Mhm.
I mean, there's so many commercial and there's no check and balance on these industries. When it comes to
Yeah.
psychiatry, when it comes to the pharmaceutical industry, there are so many people who want to tell you that you have something that is incurable, and the only way to deal with it is treat, 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 and I'm gonna give you all the pills and all the treatment you could ever want. And for many people, this free option doesn't come across their radar because frankly, no one's incentivized, right?
That's
I'm
a
selling a
really good
$30 book,
point. That's a really good
right?
point.
I
Yeah.
I don't want to do anything for anyone. If someone wants to come and find this and help themselves, great, but I'm not gonna go out there and, you know, teach people pain reprocessing therapy. That's not my business, right?
Yeah.
There's no money to be made on it,
Right.
frankly. You can do it to
Right.
yourself. And so there just isn't the commercial interest to push this to people, uh, but it definitely works. It's the most effective non-pharmaceutical intervention. The pharmaceutical interventions turn out can make the problem worse. That when you,
Mhm.
in fact, numb the pain temporarily, you do nothing but hypersensitize yourself. In fact, we see this with heroin addicts that when they numb themselves constantly, when they come off the medication, when they come off the drugs, I should say, that's where the withdrawal symptoms start because now their body has
Mhm.
to, is all out of whack in terms of what signals to process and which signals to ignore. And that's where they get these withdrawals from. And so many of the medications that
Mhm.
that are prescribed, not that I'm anti-medication, I think there definitely is an application for it for acute syndromes, but for chronic pain, it just extends, extends, extends because again, you're avoiding, 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 as opposed to reprocessing these signals, teaching the
Mhm.
brain, here's what to focus on and here's what to ignore. And that
Mhm.
takes some time, but it really, really does work. So to summarize, I don't push this on anybody. People have to find their path to it.
Yeah, yeah, and I really appreciate you laying out the path. And again, like I said, I think well articulated, well storied. I think you made a very compelling case for this, and that's why it was so confronting for me. Of like, oh, I wasn't all the way there, but you really
Mm,
laid out like the next mile, if you will, in my journey, even with my own back pain, which I thought was really remarkable. So
thank
thank
you.
you,
Well,
thank you,
yeah,
and
my
and
pleasure.
and
Let me
I
know how it
did I
goes.
I did the ibuprofen, like, I was up to, like, 800 mgs a day
Oh,
on
wow.
ibuprofen, and that was before all this data came out about how bad it is for your heart, how it's not a chronic medication, like, you maybe 3 weeks, and also, by the way, it's just as pain relieving as opiates,
Yeah, yeah,
in post-surgery, who knew, like, I had to undo a lot of the training that I had as in medical school around, pain relief, and then it went crazy because then there was you mentioned the profit motive. Opiates were being pushed on everybody, to just numb ourselves and to get out of that, and like you said, there's a really nasty kickback when you come off of those things because your nerves are fragged,
right.
and you're searching for some relief, and it's just such a painful thing to go through that withdrawal.
I think one of the unfortunate things we did was that pain scale. when pharmaceutical companies were pushing opiates, it became another
Good
vital
point.
sign, right? Your blood
Good point.
pressure, your heart rate.
Hmm.
And they asked everybody, okay, you have to check your pain. You have to check your pain. You have to check your pain. And it turns out, I think that was a huge mistake because what
Yeah.
we were doing was
Yeah.
telling people pain is not normal.
Right.
Pain is normal. We are
Right.
supposed, it's just a signal. It's not something to be scared of. That sometimes, many times, you know, experiencing that discomfort and realizing it's normal, it's gonna pass, it comes and goes like a wave, is fine. Instead, we push to people that, "Oh my god, you're feeling pain? I gotta do something about it right now. No, 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 no.
Hmm.
I have to make sure it doesn't last forever." And we freak people out to hyper fixate on the pain, as opposed to teaching people this, it's not dangerous. Not all pain is dangerous.
One of my favorite words is hormesis, which is the resilience or the strength that comes from going through hard things. And I
Mm,
think, it supports what you're saying, which is that, that there can be this almost this dichotomous path of one direction is avoidance, avoidance, which begets more avoidance. And the other one
right,
is going into this, can I, will I, should I, let's see if I can and start to build up that muscle in terms of your own resilience. I'm trying to articulate these traps that people are in that are around the space that you're pointing to, that you're trying to
yeah,
free them from. So another
and
one that I see is this kind of, I can'tness. It's not going to
mm,
work out for me kind of thing. And you start the book with something that they taught us in medical school called the swim test and the hand of God. That was how they described it to me, but, can you just take us through that? Because I think that is such a powerful way to just make your point around, how important this belief system is.
right, yeah, so the Kurt Richter study is what you're mentioning, right?
Yeah.
Yeah, this is, I talk about this in the very first chapter of the book because it another one of those studies that absolutely blew my mind. So, in the 1950s, Kurt Richter, took these rats. He had, 2 kinds of rats. He had lab rats, and then he had wild rats, and he put them in. You could do this experiment by the way, and if you are squeamish about, rat studies and animal studies, maybe tune this out for a minute. It's not that bad, but some people don't like it. So anyway, you can't do the study anymore. It's pretty ethically dubious. But here's what he did: he took these rats and he put them in a cylinder of water, and he wanted to see how long could a rat survive swimming in water in a cylinder before it gave up and died. And you would think, the gritty rats, the wild rats, they were bigger, they were tougher, they were stronger, they would definitely survive longer. That's not what happened.
Mm.
The lab rats outswam the wild rats, and he didn't know why. Why would that be? Clearly, they were stronger swimmers. They swam in the
Mhm.
wild. Like, what? Why
Mhm.
would they possibly die first? And so he did another experiment, and here was where the real surprise happened. He took the lab rats and he put them in cylinders of water, and he timed. He had a little stopwatch, and he wanted to see how long they would swim for. And on their very first dunk, they swam for about 15 minutes. And 15 minutes was the average time before a lab rat gave up and sank below the water. Then he did another experiment. He would put them in the water for the very first time. And then, right before he knew they were about to give up, right before the 15 minutes, he would lift them out of the water, pat them off, dry them off for just a second, let them catch their breath, and put them back into the cylinder. The same rats who had been swimming for 15 minutes, put them back into the cylinder. Now we want to see
Mm.
on their second attempt, how long would they swim for? And I've
Mhm.
I've, shared this example many times, and, people know there's a trick here. People know they're gonna swim longer, and sometimes they guess, "Oh, they swam twice as long, 30 minutes." No, 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 they swam 4 times as long. They swam for an hour. Not even close. These rats, when they suddenly had something change, they had, and all that was changed was that they were taken out of the cylinder, dried off, and put back in. Now they had a different belief because they had the same bodies, right? Same exact rats. Nothing changed physically. They weren't giving any
Mhm.
kind of exogenous factors. It was purely something that happened in their mind. We don't know what they were thinking, of course, they're rats, but something had changed in their perception. And because of that change in perception, because they now knew that salvation was possible, they didn't swim for 60 minutes. They swam for 60 hours. They went from
Unbelievable.
15 minutes to
Yeah.
60 hours of swimming, days of swimming. And what changed? The only thing that changed was in their heads, the idea they had been taught that salvation might come, that something might save them. And so that story really kicks off the book because, man, if we could harness that, if we could learn from that in all areas of our life, to persist. We were talking about motivation earlier and how the
Yeah.
power of belief to change motivation. If
Yeah.
we could persist 240 times longer at anything, I mean, that would be absolutely miraculous. And we can, in fact.
I want that for everybody. I really do. And so I want to figure out, how do we get, you said there's three powers, three powers of belief that you're structuring the book around. So one
Mhm.
was attention, one's anticipation, and one is agency. And, you talked about the keyhole in terms of the attention part. Is there anything else about the attention part that's critical for people to know, as that power of
Mm.
belief?
Yeah, so many interesting things. I mean, there's a chapter in the book that talk about hypnosedation. We talked about pain earlier, about how you can deal with chronic pain, but then there's also this amazing ability that we have to block out acute pain too. And so I talk in the second chapter of the book is about this guy Daniel Gisler, who's
Mhm.
not the kind of person you think would go for hypnosis. He was a former commodities trader, very type A analytical type of person, very numbers driven. And he in his 50s, he has an accident and he has to have a surgery where he has pins put in his ankle. And then 3 years later, he has to have these pins removed, and somehow he stumbles on this idea of hypnosedation, which is not a fringe technique. Apparently, tens of thousands of people have done this procedure before using simply the power of their mind to not have any anesthesia during surgery. And you say,
Wow.
"Why would you do that?" Turns
Yeah.
out recovery times are much, much faster when you don't have to go under general anesthesia. Well, Daniel learns this technique. At first, he's very skeptical. He starts with YouTube videos, then he does a professional course, and he learns how to do this to himself. And then he goes to this surgery, which is an hour-long procedure with no general anesthesia, no local anesthesia, nothing, simply by hypnotizing himself. And it's not stage hypnosis. It looks nothing like that. It's very, very different. It's not, controlling someone controlling you. That's not what hypnosedation looks like. It's actually you controlling your own attention. And what he's able to do, and again, tens of thousands of people have done these before, is focus that keyhole of attention on just what he wants to experience. So super focusing his attention, he takes himself to an island. That's what he does in his mind. And so he goes through the whole procedure and the doctors, and I've seen the video, the doctors looking at his vital signs, they're perfectly normal, they're flat. You don't see the spikes that you usually see when people are experiencing pain. So it really is in his body and mind. He is not experiencing that pain. And I tell that story not because I want people to get hypnosedation. I'm not going to do it. I tell that story because if we can do that, if someone can have flesh and bone cut open without experiencing pain, without anesthesia, just with the power of the mind, what else can we do? Right? This is an untapped superpower that we all have. So I think that's a very, very important power of the mind when it comes to the power of attention. I think with relationships as well. Oh, that's a whole nother category that blew
Oh
my
my
mind.
gosh, the relationship chapter was, I was worried for you. Like, you tell this story about your mom and how you're judging your mom, and I was thinking, "Oh my gosh, Nir's, like, just poking the bear here, like, he's gonna
Right.
get in trouble with his mom." But you did a beautiful job of landing that in
Thank you.
Byron Katie's work, and so I think that's really good medicine that you included, that you wrapped in there, and also that you applied to yourself. And it's, if for those who don't know what Byron Katie, her work is, if you could unpack that, and then also just, it's such a courageous thing to do to yourself, because your beliefs are under attack from yourself, like
Mm.
you're in there surgically redoing everything and pulling out everything and flipping it on yourself, and courageously turning on yourself. So if you could
Sure.
go through, walk everybody through that, that's really incredible.
Yeah. Yeah, this is still, not the easiest story to tell because it's, you still have those emotions, but I grew so much from it,
It's
so
your
I was
mom,
happy to
yeah.
share the book. Yeah, it's my mom, and we all, I think people will be able to relate. So essentially what happened, so, I lived in Singapore. I still live in Singapore. In fact, I'm here right now, but I'm moving back to the States. But anyway, a few years ago, but it was my mom's birthday, and I wanted to get her some flowers. And so I spent a lot of time trying to figure out how do I get flowers from Singapore to Orlando, Florida. And so I called up a florist in Orlando, and okay, it's not this one, that one. Was in the middle of the night. Okay, can you do this? Can you it's shopping online, comparing all this? Anyway, I spent a lot of time trying to get her the best flowers I could possibly find for her birthday. And I call her up and say, "Hey, mom, happy birthday. Did you get the flowers?" She says, "Yes, honey, I got the flowers, but maybe you should tell the florist they're not so nice." And my initial
Just a
reaction,
little, yeah, gets
yeah,
under the
I
skin.
instantly
Yeah.
time traveled from my
Mhm.
48-year-old self to my
Mhm.
15-year-old self, and I
Mhm.
said something like, "Well, that's the last time I do that." Something to that effect, and I instantly regretted that I said that. That was not the right thing to say, but it's an instant demonstration of the powers of belief. First of all, my belief changed what I saw. My mother had said a statement of fact. The flowers are not so nice, right? Maybe you should call the florist. Which happens. Sometimes florists try to get one over on you and they don't deliver the fresh flowers. They give you
Mhm.
not so nice flowers. I interpreted that as you're not so nice. You're a bad
Mhm.
son. You did a bad
Mhm.
job. So I
Yeah.
saw the situation differently. She had said a statement of fact. I interpret what I saw was my mother's hard to please. That was the
Mhm.
belief. I had this lens that I couldn't see, that it was hidden to me, that made me see the situation differently. Because my mother's hard to please, I can't do anything right, right? She's judging me.
Mhm.
How did I
Mhm.
feel? It affected how I felt, right? See, feel, and do. It felt awful, right? I felt
Mhm.
resentful. I didn't feel good at that moment. I became my 15-year-old rebellious self. And then what do? Right? Because of the power of belief, because of this lens, I blurted out something that I later regretted. Well, we had this birthday call, and then afterwards, my wife says to me, she says, do you want to do the work on this? And she was referring to the work of Byron Katie, who I'm a huge fan of. And Byron Katie is a therapist and counselor. She's in her 80s now, but she's done amazing work over the past several decades.
Life
And Byron
changing.
Katie takes this technique where she has us ask these questions to evaluate our beliefs. And she this method, by the way, is ancient. Aristotle
Mhm.
did something very similar. This is a
Mhm.
1,000-year-old technique where what we're doing essentially is questioning our own beliefs. Because when we have a certain perspective, when we have this lens of belief that we can't take off, and unless we do active efforts to take it off and see it differently, we can only see things one way. So what we want to do instead is to take a portfolio of perspectives to try on
Mm.
other beliefs. Now, the big picture of beyond belief is this message that beliefs are tools, not truths.
Mm.
Beliefs are tools, not truths. That is not how I used to see things.
Yeah.
I believe something is true. It's clear. My mom is hard to please. Did I just tell you what happened? Right?
Yeah.
Like, she's hard to
Exactly.
please. She's judgy. And so that's what I believed. Now, I
Mhm.
took that as fact, but that was a choice I was making because there's a big difference between a fact and a belief. A fact is an objective truth that is true whether you believe it or not, right? The world is more like a sphere than it is flat. Doesn't care if you believe in it,
Yeah.
right? That is a fact. It's objective. Then there's faith on the other end of the spectrum, right? Fact is on one side, faith is the other. Faith is a conviction that does not require evidence.
Mhm.
Um, God is good to people who are good to others. God
Mhm.
rewards good deeds. That is faith. There's no that is not a fact. Okay, there's no objective evidence for that. It's faith. Now,
Mhm.
there's something in between. A belief. A belief is a strongly held conviction open to new evidence. It's not
Mm.
fact, it's not faith, it's a strongly held conviction open to new evidence.
Mm.
And so we can adopt the beliefs that serve us rather than hurt us. So back to the story with my mom, the work by Byron Katie asks us to reevaluate these beliefs, to ask ourselves, are these beliefs really serving us? And the first question is the most annoying. The first question is you take your belief, you write down the belief. In my case, my mother is hard to please. And then we ask ourselves the first question. The first question is that true? Of course it's true. Weren't you just listening? I told you, like, like clearly she is very hard to please, right? She didn't like my
Mhm.
flower gift. So then you go to the second question. What's the second question? Are we absolutely sure it's true? Sounds like the first question, right? It's not.
Mhm.
Because now you have to think, well, is it absolutely true? Like, is there even 1% chance that it's not true? And of course,
Mhm.
there is, right? There
Mhm.
always is.
Mhm.
And that's
Mhm.
where you have that crack of possibility
Yeah.
that changes your world, changes your beliefs, because now you invite the opportunity for maybe another perspective. Doesn't have to be true. Doesn't have to be true. You don't have to change your mind about anything. All you have to do is to look at it from another vantage point. Could it possibly be true that my mother is not judgmental? Yeah. Maybe she was
Mhm.
trying to be helpful. Like, maybe she thought I got scammed, and she wanted
Mhm.
me to not order from that florist anymore to get a refund because they didn't do a good job.
Yeah.
Does that say anything about me? Does that say that I'm a bad son? Does that say that I did a bad job, that she didn't appreciate my gift? No, it was a statement of fact.
Mhm.
So, kinda hit a point. Anyway, there's a lot more that Byron Katie provides. It's a brilliant process, and I talk about how I work through it in the book. I think one of the net result of what you get from this is what she calls a turnaround. And the
Yeah.
turnaround asks you to shift that perspective through different vantage points. And so one of them, the one that was most powerful for me, is what she calls a turnaround to the self. So you take that same belief,
This is
my
the
mother is
scary
too hard
one.
to
This is the
please. Yeah,
scary
this is the
one.
scary
This
one.
is
This
the
is the
one
one
that's
that I
harder.
hated to do. That you take my mother is hard to please, and you turn it to the self. I am hard to please.
Mm, that's rough.
I needed my
That's really rough.
mom. It's really rough, right? I needed my mom to thank me in the way that I think I deserve to be thanked.
Mhm.
I need to be appreciated the way I believe I need to be appreciated, right?
Mhm.
I'm hard to
Mhm.
please.
Mhm.
I get goosebumps saying it to you right now. It's true.
That's
It's
that's
absolutely
really
true.
yeah. That's
And
deep.
so it is deep. And what I
Yeah.
love about this process, and I detail it as efficiently as I can because I use it all the time. It's mind blowing because what it allows you to do is look at relationships completely differently. Because once you realize that we don't see people, we see our beliefs about people. And so
Mhm.
what we do when we have a certain belief that a certain person is a certain way, we look for confirmation. We look for, they're doing that thing again. See, that person always does that thing. And
Mhm.
we think it's all about us. It is all
Mhm.
about us because that is the lens that we are reinforcing again and again and again. And so we don't see people accurately. So this process allows us to take a step back and realize that we don't have relationship problems. We have perception problems.
Yeah, and to get to that level of courage though, it's like it made me wonder, is that a beginner activity or is the turning to the self, is that kind of a more advanced level? Like are there more readily accessible things for maybe somebody who is highly defended and they're hiding behind their judgment of others in order to feel safe, and it's too threatening for them to maybe they don't like themselves. Maybe they have so much self-loathing that turning it to the self might be a little too intense or a little too strong in the beginning. Have you seen anything about, kind of working your way up to this, I'll say mental yoga? We know it to be
Mm,
cognitive flexibility, which you mentioned in the book, like
mm.
do you think there's stages of greater and greater flexibility that you get to that really you're exemplifying in the book, but might feel like, whoa, that's a lot, for somebody like myself who might be not as courageous yet.
Mm. I I think it's important to start with the relationship, not necessarily with the technique, the intensity of the relationship, I should say. So,
Mm, mm,
um,
that's good.
I have seen these techniques used for people who are struggling with severe trauma. Like you would not believe the levels of trauma that people go through, and use this technique to free themselves from the belief that they should carry that pain forward, that they should suffer from it. Again, the pain is real, the suffering is the optional part. And so I've seen people, like with my own eyes in counseling sessions, free themselves from that suffering, from the most severe trauma you could ever imagine. So, but would I don't know if I would recommend going all the way there right away. I would start with relationships where you have more love. And what do I mean by that?
Mm, mm,
I'll tell you how I define love. Love is measured by the benefit of the doubt. Love is measured by the benefit of the doubt. So how much I love somebody has to do with how much grace I give them. When my daughter was first born, uh, when you have a child, your heart cracks open and you love something that you didn't imagine that you would love. This, you know, mushy, wet, disgusting thing that comes out of another person. All of a sudden, you love this thing more than anything you could imagine, and
mhm,
you give it complete grace. She
mhm.
cries. That's annoying, but you love her no matter what. You give her complete
Yeah.
grace. The babies poop and pee, and all they want is to eat, and they're very high maintenance, but you love them so much because you give them
Mhm,
so much grace.
mhm.
Well, we're all big babies,
Yeah.
right? We're all big babies. We all make mistakes. We're all doing the best we can. We don't blame a baby for crying and pooping because that's all they can do. That's the tools they
Mhm,
have at their disposal to get what they want,
mhm,
right? Crying is
mhm,
how they ask for help. And we're all the same way. All
mm,
of us. We're just operating from the best tools we have at our disposal. So love is measured by the benefit of the doubt. So what I would recommend is starting with low stakes situations, right? So for
mhm,
me, I started the work with my daughter. I have a wonderful relationship with my daughter, but from time to time, yeah, we would do things that hurt each other's feelings. And
Yeah.
so starting with a relationship where I gave her a lot of grace, where I love her so much, and
Mhm.
now I'm gonna make that a little bit better by using some of these techniques, maybe some of the
Mhm.
rough edges, maybe some of the things that, previously would annoy me, I would work through these questions. And then it
Mhm.
could go up and up and up, right? And then I worked with my wife on this stuff, and then, it could work up with more difficult relationships and situations.
That's a really great way to describe the laddering up of that, so going to another trap that I saw that you, really shone a light on in the book was diagnosis as me. You tell a story of somebody who, was diagnosed with anxiety disorder and or depression and then became his identity, and so he almost, like, withdrew, self-fulfilling prophecy wise, from society. That's supported, even in the span of my career from medical
Right.
school to now, doctors went from actually having conversations with patients to having 10 minutes, just enough to, like, type in the script,
Right.
and so that they're prescribers, they're not even healers in many cases, and it's not that they don't want to be. It's that the system has become so resource constrained and so hurried and so optimized that that part of medicine practice has just gone away and maybe reinvented itself in functional medicine or retail medicine or those kinds of things where there's more time added back in. So, what do you think is important about avoiding that pitfall, if you will, of the diagnosis or the pills? What is your point of view
Mhm.
around, medications, which we're going to get that. If you go into a
Yeah.
doctor, you're going to get a prescription, right? You're not going to get
Yeah.
a lot of this other stuff, like you said, that the profit motive isn't really there either.
Yeah. Well, first of all, thank you so much for reading all the way through the book and diving into it so
Oh,
intensely. This is I
I
love
was
talking to you because
so
of this. It's
oh,
so nice of you.
I was all up in this book. Yeah.
Thank you. Thank you. So this is almost the last chapter of the book. It's also the most controversial chapter, and the chapter is called "Your Labels Are Your Limits." And
Mm,
I started the chapter by telling the story of a guy, patient X, who barges into an emergency room and he collapses to the floor and he tells the nurses who come to get him, "I took all my pills. I took all my pills." And it turns out he attempted suicide because he had a bad breakup with his girlfriend, and he took all the pills that he had in his bottle. And they ask him, "Well, what did you take? What did you take?" He says, "I don't know." He I'm and they he the patient shows the medical staff the bottle, and it turns out he was part of an experiment. He was part of a
mm,
clinical study where they were
mhm,
testing the efficacy of medication. So they called the lab. Okay, what was this? What was this medication? So we can cure this guy. And by the way, his heart rate is plummeting. His blood pressure is at a dangerous level. Everything is showing that he's had a drug overdose. And so they get the results back, and it turns out that he was in the placebo group, that he had what he had taken, what he had overdosed on was
mhm,
an inert substance, right? Probably a
mm,
sugar pill or something. And
mhm,
so within 15 minutes, he goes from this critical state to completely normal. Once he's
mhm.
told, "Hey, you took a placebo. There's nothing in this." And so I use that as a story of an example of what's called the nocebo effect. So placebo comes from the Latin "I will please." Nocebo is the opposite of that. Is then when we take something and it actually makes us worse.
Mhm.
And unfortunately, I think we are swimming in nocebo effects. Not so much in
Yeah.
terms of the things we pop into our mouth, pills, even though that those can have negative effects as well. We can talk about that. But I think these are psychological nocebos. Starting
Wow.
with the most dangerous one is our labels. That the
Mhm.
chapter is called "Our Labels Are Our Limits."
Mhm.
That I think in many cases we have gotten to a point where, like you said, it's so easy to assign a label to someone. That's the conventional path. In 10 minutes, I can give you a label. Here, you've got such and such, and now I've done my job. And in fact, if I don't do that, now you're going to leave me a bad review on Yelp or on Google reviews. And so I'm kind of
Absolutely,
incentivized
absolutely.
to do
Like,
that. Yeah.
yeah,
And
yeah.
there's really no check and balance. I mean, I wanted to test this myself. I went and got an ADHD diagnosis. I wanted to see, like, honest to goodness, I just told him the truth. I was not trying to game it at all, right? I just told him the truth of what I was experiencing. Do you and it's a Likert scale. Do you experience this? Do you experience that? How often? Very often, not so often. So to me, yeah, I get distracted a lot. right? And hey, lo and behold, I got an ADHD diagnosis, right? I've never heard of anyone who's
Congratulations.
done a test. Yeah. Well, the thing is, I've never heard of anyone who's taken the test and not gotten an ADHD diagnosis. If you go to get one, you're going to walk out with a diagnosis. Now,
Yeah.
I'm not saying that there's anything wrong with that. I think there's a lot of people who benefit from a diagnosis. In fact, I think the thing we need to watch out for is called the Rumpelstiltskin effect. Do you remember the story of Rumpelstiltskin that
Yeah. Yeah.
the princess
First male
when she
child.
can name the little gremlin guy,
Hmm.
she's
Hmm.
freed. We
Hmm.
need to be careful of this Rumpelstiltskin effect. It feels amazing. It feels so good when you
Mm.
can name the problem. And
Yeah.
many times it's very effective, right? If you can say,
Yeah.
"Ah, this is my disease. Okay, now I can find the cure."
Yep.
The problem is that it can become too comforting. It can be comforting in
Hmm.
a way that hurts us as opposed to helps us. So,
Hmm.
for example, this task is really difficult. That's my ADHD acting up.
Right.
I'm having a senior moment.
Hmm.
Right? We hear this stuff all the time. It
Hmm.
does not serve us. It
You
doesn't help
mentioned
us.
neurodivergence,
Yes,
and the one that scared me the most was the social media, epidemics, that there's these diseases that just by suggestion uh,
right.
carry around the internet, and then everybody thinks they have these things. It reminds me of, again, medical school, first year of medical school. Every time you learn about a new disease, you think you have it,
Everybody's
and
got it.
it's very, very contagious and very
Very
dangerous
contagious.
as a
That's
result.
exactly right. Yeah, no,
Yeah.
I talk about these several cases of, all over the world, you find these cases. There was an amazing case in, I think it was Chile, where there was an outbreak of teenagers going to the hospital, all suffering the same symptoms, severe symptoms with stomach cramps, and, oh, they were in such pain. It turns out there was a television show where the main character had this illness, and then everybody all of a sudden got it. It became this psychogenic illness. So this is real. This happens when we talk constantly about, neurodivergence and ADHD and insomnia and anxiety disorder. I'm not saying these things don't exist. That's not what I'm
Yeah.
saying. I want people
Yeah.
to very clearly understand. It's that we can overdiagnose and over-index on it in a way that doesn't help us. And so what's the line? Where do we know it doesn't help us? It doesn't help us when our labels become our identity, right? As opposed to, I'm struggling with focus. I am ADHD. It's who I am. It's
And
my
and
identity.
and
And don't
why
tell me
why?
otherwise.
Yeah, why is that? Like, that may seem obvious to you because you've researched this for 6 years, but,
Mm.
why is it that that's a trap? Why
Uh,
can't I just have my anxiety disorder and that's my friend and it's with me the rest of my life and it serves me and I struggle with it? Like, why is that so limiting and gonna hurt me ultimately?
well, first of all, if it's working for you, I'm not going to tell you to change. If your life is
Mhm.
happy and you're accomplishing what you want to do and you're satisfied, I'm not. I don't want to change anyone. I will tell you that what I've discovered for myself and for my family and the people I've worked with over the years is that there's a trap where this can become a self-fulfilling prophecy, and I'll tell you exactly how it happens. When I am thinking about here is the struggle I'm having, and immediately I am triggered to think about what is limiting me from
Mm,
overcoming that obstacle,
mhm,
now that becomes the focus of my attention. Again, the brain can only process 50 bits of information per second. So
mhm,
now, if what I'm processing is, ah, I'm too old for this, I'm having a
mhm,
senior moment, or
mhm,
that's my ADHD acting up, or that's my
mhm,
anxiety disorder acting up, am I solving the problem? Am I thinking about a
mm,
solution?
mhm.
No, I'm ruminating, just like what we actually this is a perfect segue for what we were talking about at the very beginning around
Exactly.
chronic pain.
Yep.
Chronic pain is when the fear accentuates the discomfort. And that's
Mhm,
exactly what happens when our labels become our limits. We start thinking about,
mhm.
is that ADHD again? Is it going to get worse? Am I ever going to get better? Am I going to have this my whole life? Is this ever? Now I'm training the brain to be in a constant fear state. And that only makes it worse because I'm not able to focus on really what I want to do.
Yeah, and it also takes away what we were talking about right before this, which is that cognitive flexibility. You're not gonna
Mhm.
become cognitively flexible if you are satisfied. You check the box of like, "Oh, I'm here," and there's no effort to get out of it because you've just
Mhm.
resigned yourself to, "This is me," right? And so
Great point.
that kind of also ties into the very last conclusion, which really was music to my ears around the power of positive thinking.
Oh.
I was so happy that you debunked that because I have family members who will hear this podcast And they are so into the book The Secret, which is an old
Mm,
book,
I
but
know,
it
yeah.
promised it was the big kind of breakout book around law of attraction, and like if you just think it, you'll be wealthy, you'll be beautiful, you'll be all these things. And actually, incidentally, last week I interviewed somebody who just happened to mention that one of those authors is filing for bankruptcy,
Oh,
so
really?
it
Oh,
didn't quite
no.
work out the way that
Didn't work out, didn't manifest enough of the abundance, I guess.
exactly, exactly. And I'll give you one more fact to play with, which is we've done research on, I study something called iterative mindset, which I found in the field and very similar to a lot of these things. And you and I should compare notes after this.
Yeah.
And optimism was the second most powerful protective factor for long-term change, right? Iteration being the number one. But why was it second? Why is it not sufficient to just be an optimist? Why is it not sufficient to just power positive thinking, law of attraction, the secret? Why doesn't it work, Near? What's going on there?
Well, okay, the first reason it doesn't work is that, the universe, doesn't give a shit. That the universe is not there to serve you.
Yes, thank you
That's
for the
not how it
sobriety
works.
check. We really
Yeah,
appreciate that.
exactly. So that's the quick answer. The longer answer, and there's been studies on this. It's fascinating when they ask people to do positive visualizations to manifest their future, to think about the future they want. Right? I want to have six pack abs. I want to find the love of my life. I want to have a Lamborghini. I want these things. I want. I want. I want. When you put people in a lab and you ask them to do these manifestation style exercises, it turns out that physiologically we can see them relax. Their
Mm.
blood pressure lowers, they become more relaxed, and it turns out that over time, they become less likely to go out and do the things they have to do to get those things. Because
Right.
I've already done the work. I've already manifested this. I've already visioned this. I've already done the work on this. It should come to me. And so they become more relaxed and less likely to actually go do the work.
So it
The
takes
good
away
news
your
is
motivation.
exactly, their
Okay,
motivation decreases
gotcha.
because they
Oh,
believe
wow.
it's coming.
Wow.
So that's where we can use, I talk about that section of the book is called good beliefs, bad beliefs. And there is
Yeah.
such a thing. There's a delusional type of belief. And I think
Yeah.
positive thinking is one of those delusional beliefs oh, the good things will just come to me. That's not how it works. Positivity is very healthy. Looking for optimism is very healthy, but just thinking positive and then things will happen, kind of, manifesting in the secret type stuff has been shown actually to be actively harmful. The good news is that we can do it correctly. The right way to visualize is not to visualize the end outcomes. The right way to visualize, and this is the way athletes do it. People will say, well, how can you say visualizing doesn't work? Athletes do it all the time. Yeah, but you don't know how they're doing it.
Mm.
Athletes don't visualize getting the gold medal. They don't visualize, winning the race. That's not what they visualize. You know what they visualize? They visualize the obstacles in their way.
Oh,
The
wow.
basketball player is thinking, when that person's coming to me, I'm going to do this and then I'm going to do that. They're thinking about the obstacles. They're thinking about it's deliberate practice in their minds. So the
Mhm.
right way to visualize, for example, if you're trying to lose weight, right? We talked about
Mhm.
our
Yeah, yeah.
struggles with weight in the beginning. When I really started to use visualization to help me was when I said, okay, I'm on a diet here. I need to control my weight better. I need to be healthier. In order to do that, when I go to this party on Saturday and someone offers me a drink, what am I going to say? When someone gives me the birthday cake, what am I going to say? That's the right kind of visualize, to practice the obstacle and what you will do to get around that obstacle, not the outcome.
Yeah, yeah, there is a thing called implementation intentions, mental
Yes.
contrasting, MCII, that draws on that, but I think that's so nuanced, because people do not understand that if they picture the outcome versus the process and how they're gonna, manage and we dodge and weave in the process and how they're gonna be flexible in the process, that's such a huge difference in outcome for that person, so thank you for picking on that. And then my biggest surprise of the book, aside from the shared you and I weight loss thing, is that we also share something else really weird, which is that as children, we both, me in Oklahoma, you, where'd you grow up?
Orlando.
Orlando, you in Orlando, would sit on our driveways as kids and look up at the stars and pray or wish or vision or whatever. And I really just saw you as this kind of like chosen child, like you that of course you had kind of an intention or a prayer And it caught me off guard actually because I didn't know you to be you didn't really broadcast ever, a faith or anything like that necessarily, to me at least, in our prior interactions, and weren't open about that or weren't, of course, certainly not, promoting of that in your life. And you're not in the book. You're not. You're taking still the scientific mind to it. You're saying what works, what doesn't work around faith and around belief in spirituality, and how is that an advantage, over just positive thinking, for example, and those compare
Right.
and contrast. And you go through this, like, I don't know what inspired you, but you go through this multi-faith leader kind of interview
Mm,
process where you're doing research, and maybe I would love to know what inspired you to do that. And then
sure.
you come out with extracting what I think is a really good take on the benefits of each of those traditions. And then you come out with this shocking, recommendation around how to approach religion. And I'm just like,
Yes.
who is this? Did Nir have a awakening or something? Like, what
Kind of,
happened to him?
kind of,
What
yeah.
happened to Nir? So yeah, just take us through that, whatever you're comfortable with.
Sure. Yeah. So, um, yeah, as you mentioned, I have not prayed for my adult life. The last time I prayed before writing this book, and I'll tell you how I came to prayer, was when I was a child and my family was going through a very rough time. My parents were on the verge of divorce. They were scammed out of hundreds of thousands of dollars. It was a really rough time. And so my outlet during this very rough patch was to pray. And I remember going on my driveway, and there was an oil stain right next to me where the car used to park, and I would look up at the sky and I would talk to God. And then as I got older, I thought, "Well, I'm talking to nobody. What's the point of this?" And I didn't pray for years, for decades and decades, I didn't pray. And then in the research for Beyond Belief, I came across these fascinating studies that I couldn't ignore about the power of prayer, about how amazing prayer is for those who pray in terms of
Yeah.
health benefits, in terms of social connection, in terms of, everything that you could want in life
Mhm. Mhm.
they were doing better on, and it seemed to be that prayer had this incredibly protective effect on one's psychological and physical well-being. And frankly, Kyra, I got kinda jealous. I wanted some of that, right? Because there are very few
I
things
want
that you
what
can
he's
come across.
having. Yeah.
Yeah, there's very few things that you can come across in literature that are free and have such powerful effects. And so I thought, "Well, how do you do that?" Well, I don't particularly believe in anything supernatural. What am I gonna do? Turns out that prayer works even without faith, and
Now
that
that
blew my
say
mind.
that again. Say that again because I think that is so no, it's not controversial, but it's shocking, really,
Yeah, yeah.
Say that
That
again.
prayer works without faith, and in fact, the reason I think it's so important that people know this is that the largest religious group in the United States of America, about 30% of Americans, are nuns. The largest religious group are people who
No
are
kidding.
none, nothing. On a form, they say none. That's me. And that I don't particularly but a lot of people say, "Oh, maybe they're spiritual, but not religious. They don't particularly go to any one faith or another." And I think maybe we got it backwards. I think the right way to be is not a lot of people say, "Oh, I'm spiritual, but not religious," because they're not comfortable to going to any particular institution. What we've lost is the power of these rituals and these prayers, particularly within the context of some kind of religious group. And so what I kinda came out with the other side, so I share with everyone kinda what's in the book about that Kyra read around, about the interfaith, conversation. I went to, 5 different religious leaders, and I asked them all the same question. How does one pray even if they have questions about God, even if they have uncertainties about God? And I tried to take from each one of them, and I only talked to one religious leader, so it's not a representative sample, but I tried to look for kind of the essence of what someone who may not particularly ascribe to something supernatural, what could they take away from these faith traditions to incorporate in their own lives? And so I kind of highlight these 5 key pillars of what anyone can use, whether you're a person of faith or not, doesn't really matter, that you can utilize in your own life to enhance, your well-being, through this power of prayer. And I have to tell you, I pray. Now I pray. I never have prayed all my adult life, and now every time I walk by a temple or a shrine here in Singapore, we have many of these, and so whenever I walk by a mosque or a church, I'll stop if the doors are open, I'll go inside, and I pray, and I also pray differently. I thought, prayer didn't really resonate with me because I always thought it was about, asking something from Santa Claus. Here's what I want. I
Yeah.
want health. I want wealth. I want happiness. I want a
That's a
spouse. I
big
want, I want, I
barrier
want.
for a lot of people. They
Yeah,
don't feel comfortable with that. Yeah.
exactly. I certainly didn't because
Mhm.
because frankly, like, is God listening? Is God's job is to, like, help me with my to-do list? It didn't make sense to me. Now, I don't criticize, whatever works for you. It didn't resonate for me. And then I learned, from from looking deeper into and asking these religious leaders, like, what do you say? Not the liturgy, but what do you say to God? What do you ask God for in that conversation? Not the things you're supposed to say that everybody says, but when you're having that personal conversation. And so what I do now is that I don't ask for outcomes. I ask for the means, right? I ask for, don't give me health, don't give me wealth, don't give me prosperity. Teach me how to weather the hard times. Give me
Mhm.
resilience, give me wisdom, give me patience. That's what, and really what I'm asking is myself to focus on patience, is to focus on wisdom, is to focus on perseverance. I'm refocusing my intentions in that way. And so that's been something that's been incredibly beneficial to my life. And I think, uh, yeah, I think others might resonate with that as well.
I'll just do one little, like, caution from Native American tradition because I'm half Native American and half
Mm,
white, and, yeah, I heard one medicine man say one time, like, "All these people who pray for strength, watch out, because
mm.
life will make you stronger, but it's gonna be, like, a lot of trials that come to you, so
That's
instead,
true.
pray for health and happiness," or whatever
Yeah.
his recommendation was. I really
Mm,
appreciate that, and then you also land on, the power of ritual, and you also debunked, things that are not well-established faiths and how I never thought about this, like, that they kind of come and go, they're fleeting, even a lot of new age practices. I live in the Bay Area, so that's, rampant here, a lot of, like,
mm,
fantastical ideas about spirituality. Go knock yourself out, and that's great for everybody. Whatever works for you is my opinion. But
mhm.
I really was surprised that you were like, rethink. Yes, these are flawed. Yes, these faiths are flawed because they're made up, in my opinion, of all of us who are imperfect people. But if we look for the good, if we look for like the utility and
Yeah,
the benefit of them to reconsider that, there is a groundedness across time. There is a lineage there. That there
that's right.
is an ancientness in many cases,
Mhm.
and for us to kind of trust that in a way and
Yeah,
and adopt whatever rituals we think are gonna be good medicine for us.
absolutely. I think one of the insights that I got from, the Catholic priest I talked to, he told me how people will come in to church and they'll ask for all these things. They'll say, "God, please give me, I'm looking for my spouse. God, please, help me. My business is struggling." And he said the most powerful part, to him was that we do it together. And so when people pray together, when we come to church and do this, many times we will find, "Huh, that guy or gal is kinda nice," right? We might find our spouse there at church, or, "Oh,
Mhm.
that person might be able to help me with my business struggles." And so what may be the way that God works is by bringing us together in ways so that we can help each other solve these problems. And so that's how he answers our prayers. Maybe it's not, oh,
Mhm.
it shows up at your doorstep wrapped in a bow, but that he's giving us opportunities. And so back to what you were saying about the research around more the new age stuff and why those don't last. I wish they did, but they don't. Right? Like Sunday
Yeah.
Assembly was supposed to be this secular group that got together, and most of those chapters closed down. I think 2/3 have closed down. The
Mhm.
atheist associations, and I would consider myself to be agnostic, and so it's difficult for me to say this, but we lose a lot by not going to these established religious institutions, and so what I advise is to have, is to maybe be humble, is to go in and to say, "Look, I don't have to have everything be true." That's, what I told you was the big takeaway from the book is that beliefs are tools, not truths. And so it doesn't have to be exactly true. I don't have to
Yeah.
agree that, oh, the way the world was formed was exactly as it says in the Bible to the T. It's all literal.
Right.
Maybe I
Right.
don't have to have that requirement. Maybe I
Mhm.
can walk in there and say, "Look, I'm gonna have an interpretation that I'm gonna keep to myself." That's okay. I think, also, I think religious institutions, should stop having a purity test, right? Nobody asks the Pope if he
Absolutely.
really believes, right?
Right.
Why
Right.
why do some institutions, no, you have to say that, unequivocally, this is the word. That's why people are leaving. That's why people aren't going to these institutions, and I think we are really missing out.
We live in a time when AI is rising. At this recording, there's a lot of isolation. There's a lot of people getting pulled into, digital vortexes and not getting together, not having community and feeling
Sure.
despair, feeling loneliness, feeling depression, anxiety, all these things. What would you say about the link between what you're saying about our beliefs and our health, our mental health, our spiritual health? Like, how does it all tie together? And how do we as a species survive and thrive in these times when
Right.
there are, you know, eh, really big changes on the horizon, big, sea changes happening in our society, especially the technological side of things?
Yeah, I think the most important thing you mentioned in terms of the most predictive psychological trait of adaptation, that when things are uncertain, we need to be able to adapt. So I think so many of our problems today in the world come from people confusing facts and faith for what are actually beliefs.
Mhm,
That we
mhm,
love the certainty of facts and faith. They give us assurance. They give us a rock. They give us something to cling to. But most of the things in life are not facts, right? Will this business venture work? Will this person be the right person to marry? Should I do this project or that project? There's so many uncertainties in life that can't be facts. They have to be
mhm,
beliefs. They are
mhm,
convictions that are subject to further evidence.
mhm.
When my wife and I got married, I had a conviction it'd be a great marriage, but it's open to evidence, right? Like, we'll see what comes. We make that
It's a
promise
day
to each
by
other,
day
and
experience, yeah.
yes, exactly, and it's my job to be in a relationship that makes her want to be with me and vice versa, right?
Mhm,
So
mhm.
that, I mean, that it has to be a day by day thing. It has to be something that is able to adapt, and after 25 years, it's working, I think, because we continue to adapt and test these beliefs. I think the best thing you can do in a time of uncertainty, like what we're going through right now, by the way, that humans have always gone through. I mean, we
Mhm,
always
mhm.
recollect the past as stable and nice and the good old days. There's always craziness. Craziness is nothing new in world history. Any student of history knows that this is the best time to be alive. That
Mm,
is also, by the way, a belief. Like, I
mm,
think having the perspective, knowing, and choosing to believe, and I think the case is pretty convincing, that we have a lot of wonderful things in the world today. I think it's so easy if we gorge ourselves on the media diet of gloom and doom. And by the way, that's what the media does. The first rule of journalism is if it bleeds, it leads.
yeah,
The way the media gets us to pay attention is by telling us all the horrible things that are happening,
yeah,
but that's not reality. There's a
yeah.
wonderful book I think everybody should read called Factfulness by Hans Rosling,
Mm,
where he had a quiz that
love
he
him.
gave college professors, right, about the state of the world, the state of education around the world, democracy, the environment, all the things about the world. How are things going? And these college professors, the most educated people on the planet, did worse than monkeys on this test.
Oh, wow.
If you had given this test to monkeys, they would have done better than these college professors. They did less than random chance because we are so out of touch with what is happening and actually happening in the world. So again, this keyhole of attention. If we
Yeah.
choose to think about only what the media wants to show us about this scary thing and that scary thing, we'll be
Mhm.
miserable. But if we
Yeah.
choose to change our aperture, if we choose to have beliefs that serve us rather than hurt us, we can live a much healthier life.
Oh, I love that. I love that vision. I'm with you. And I thank you again for providing such an inspiring, fact driven, showing the way out of suffering book for everybody. I think it's the right time to be delivering this medicine in this world. The last question I have for you is this is my first season of this podcast. And I want to adapt. I want to believe the right things. What iteration should I make on this podcast that you think we should iterate on from here?
Well, I want to compliment you, and I think you are giving your listeners a huge gift because you are genuinely interested in the work of the people you invite on the show. And
I
I
am.
can't tell you how many podcasts I go on and say, Nir Eyal, you wrote a new book, Beyond Belief. What's it about?
Do
And
your
so
homework.
it is a breath of fresh air. Let me tell you that you put in the
Yeah.
work to really digest the book, to come with great questions. You're giving the world a tremendous gift with this curiosity because I can't do it, right? I don't know the kind
Mhm,
of questions you're going to ask, and so it
mhm.
helps me process my thinking and make myself better in terms of what I share with others. So I really appreciate it personally. You've given me a great gift, and so I would say just keep doing what you're doing. You're doing a wonderful job.
Thank you so much.
Thank you.